We're responding to a call about a male patient who has fallen from a 2-meter tree. We're aware that he has a right angulated ankle, a 15 centimeter laceration on his left forearm. He's also got some midline pain. We're checking for any safety hazards towards us or the patient, also potential exit route in case we need to leave the scene quickly. Taking into account the weather, which seems to be fine, it won't hinder us reaching the patient. And we have our PPE on, and we've checked that it's safe. Are you happy to approach the patient, Taha? Okay, cool. We're going to do that now. Hello sir, my name is Christian, this is Taha, we're from the ambulance. How are you feeling at the moment?
Very sore.
Very sore? Okay, we're going to give you something for the pain very soon. Taha, if you could just please do a rapid trauma sweep. Is that okay?
Okay.
And I'm just going to tend to your 15 centimeter laceration here, is that alright?
I'm just going to feel around, and if you feel any pain, just let me know.
Okay, so I'm using saline solution, and
Ow.
I would expose the limb. If I couldn't, I would use clothing shears, and that's so we can actually see the whole limb and where the bleeding's coming from. Using the saline solution onto the wound, and that's to clean it.
You're
Also
right,
applying it to this large combine dressing that I have. And I have a large one because it is a large laceration, and I've doubled it over just to help make it thicker so that it can absorb the blood. Taha, did you find anything significant on your rapid trauma sweep?
Yep, so he's got midline pain in his spine and right ankle.
And his right ankle. Okay, if you could just get the C-collar ready, please. And I'm making sure that as I'm wrapping, I'm also going to twist to add more direct pressure, and that's going to help stop the bleeding. So you could just tell me what you were doing at the time of the fall, guys?
I was climbing a tree.
You were climbing a tree?
Yeah.
And then you just lost your balance and fell, or something else happened?
Yeah, the branch broke.
Branch broke, okay. Well, that must have been quite sore, so we'll give you something for the pain very soon.
Thank you.
I'm just going to place your hand on your chest just to elevate your laceration, okay? And so now that we've managed the laceration, we are now going to apply a C-collar. Indications for a C-collar include a suspected or confirmed C-spine injury, and if the patient is supporting their own neck with their hands. So he does have some midline pain, so that's why we're going to apply a C-collar. Is it okay if we just apply the C-collar to you, Jairus? It's going to help with your neck pain and keep it in place.
Yes, sir.
Okay, cool. My offside Taha here is just going to place her hands on either side of your head to support it. And I'm going to measure the patient's neck from the shoulder to the jaw using my fingers, and that's about 4 fingers. So I'm going to adjust this. Adjust it to the right setting so that it is comfortable for the patient. Okay, so on 3, Taha, I'm just going to get you to lift, and on 3 we're going to lift your head. Is that okay, Jairus?
Okay.
Cool. So 3, 2, 1. Okay, there we go. Okay, does that feel alright?
Better.
Better? Okay, so that's just going to help immobilize his neck so it doesn't move any further for it to be injured more. Jairus, if you could just tell us on a scale of 1 to 10 how bad your pain is, 10 being unbearable.
About an 8.
About an 8. Alright, Taha, if you could please pass me the methoxyflurane. The patient has told me their pain is an 8 out of 10, which indicates he has some quite severe pain. So I'm going to give him methoxyflurane because indications for methoxy are moderate to severe pain. And it's quite good because it's self-administered, so he can give it to himself while we're tending to his other injuries, like his right angulated ankle. Before I do so, I'm just going to do a drug check. So I'm checking that it says it's methoxyflurane. I'm checking the ampule, it's 3 mils, he can have up to 6 mils. The liquid's clear of debris, hasn't been opened, expires next year in March. And Taha, if you could please do a drug check as well on that.
Yep, methoxyflurane expires next year. It's not broken.
Okay, good. I'm also going to ask the patient some questions. So, Jairus, are you allergic to methoxyflurane?
No.
No, you're not. Do you or your family have a history of malignant hypothermia?
No.
No? Do you have any renal problems or kidney problems?
No.
No. And you haven't had this within the past week?
No.
No, you haven't. Okay, if you could just wriggle your fingers on your right hand for me. Yep, so you can obey commands, which is good. So I'm going to give you this methoxyflurane. Side effects do include nausea, drowsiness, feeling a bit dizzy, but this is going to ultimately help with your pain. It's self-administered, so I'm going to place it in your left hand, just wrap it around your wrist. And I just want you to inhale it when you feel any pain, and you can block the bottom for added relief. Cool? Okay, cool. So now that we've managed the pain, we're just going to grab some vitals. Taha, if I could please get you to come around here and check the laceration again to make sure that it's not still bleeding. Okay, Jairus, is it okay if I just take your heart rate?
Okay, it's still bleeding.
It's still bleeding? Okay, if you could just reduce that, please. Okay. I'm just going to check your heart rate. There's my hand here. And I'm just counting how many beats over 15 seconds, and then I'll times it by 4. A normal heart rate is about 60 to 100 beats per minute. Anything less than 60 would be concerned about bradycardia. Anything more than 100 would be concerned about tachycardia. And that's okay, so the patient's heart rate is 60 beats per minute, which is good. Jairus, I'm also going to take your blood pressure. You might want to take a few puffs of the methoxy before I do so. The blood pressure cuff is going to get quite tight around your arm. Alright, just going to expose this arm. And we're taking the heart rate because we want to make sure that the heart is working efficiently, and we also want to make sure that with the blood pressure it's pumping right efficiently. Okay, so to listen, I'm going to pump it up to about 120. Yep, so the patient's blood pressure is 120/80, which is within the normal range. Anything below 90/60 would be concerned about hypotension, and anything over 125 would be concerned about hypertension. If I could just please get you to get the splint ready for the patient's fracture while I continue taking some vitals. So I'm also going to take the patient's capillary refill. So Jairus, I'm just going to squeeze your finger. Is that alright? Yep, so patient's capillary refill is 2 seconds, which is within the normal range of 2 to 3 seconds. If it was any longer than 3 seconds max, would be concerned that there was quite poor perfusion in the body. Also going to check the patient's respiratory rate. Checking that to make sure that his lungs are working well. I'm looking for chest rise. Just going to move your arm down, Jairus. I'm looking for chest rise, counting the breaths over 15 seconds and times by 4. Also looking for any sucking out of the rib or difficulty breathing or wheezing. Yep, so the patient's respiratory rate is 12 beats per minute, which is good between the normal range of 12 to 20. Anything over 20 would be concerned about hyperventilation, and anything below 12 would be concerned about hypoventilation. Also going to auscultate. So Jairus, I'm just going to use my stethoscope to listen to your lungs. Is that okay? Okay. So I'm going to listen to the lungs also to make sure that his lungs are working well. And I'm going to hold each position for about 2 seconds, listening for any absence of breath or decrease in breathing, any wheezing or stridor. Absent of breath or decrease in breathing might indicate a tension in the thorax or like air and fluid around the lungs. Okay, and the patient's lungs appear to be clear, which is good. Moving on, we're going to now try and manage this fracture. So my offside Taha here has measured the splint. The reason we're using a cardboard splint is because they can be cut and shaped to size, and it's about this size up to the knee because we want it to the splint to support above and below the fracture, which is here on the ankle. We have a towel for comfort. So I would expose both limbs, and that if I couldn't, I'd use clothing shears. And I'm doing that so that we can compare the uninjured limb to the injured limb. And I'm checking for sensation. So, Jairus, can you feel this?
Mm-hmm.
Yep. And can you feel this?
Yep.
Yep. Usually I would remove the patient's shoes and socks, but for the sake of this video we won't. I'm also checking colour, so this limb appears to be okay. This one is okay, just around the ankle we have some bruising, a bit of discoloration, which would be from the fracture. I'm going to check the capillary refill time on both feet. 2 seconds within the normal range. Yep, 2 seconds as well. Also checking for movement. Jairus, can you move your left foot? Yep, and can you use right one? Yep, and that's sore, you can't really move it. Alright, so I'm also going to take a pedal pulse of both feet over 15 seconds, again times it by 4. Normal range should be 60 to 100. That one's 60, which is good. Checking this foot as well to compare, and that one is 60 as well, which is also good. And so indications for a splint are swelling, a suspected fracture, or any shortening or rotation of the leg. And we've got our triangle bandages here, which our offsider has prepared, which we're just going to slide under the knee. Thank you, Taha. And we'll just move it one down here and keep one up there. Before we apply it, I am going to get a pain scale so that we can give the patient further analgesia. So, Jairus, on a scale of 1 to 10, how bad is your pain?
About a 4.
About a 4, okay. So that lets me know that the patient still has some mild pain. So we're going to give the patient some paracetamol, because an indication for paracetamol is mild pain or with other pain relief, like the methoxy. So Taha, if you could just get the paracetamol out for me, please, thank you. And I'm going to ask the patient some questions before I do so. So Jairus, do you have current paracetamol poisoning?
No.
No, you don't? Okay, that's good. And you're not allergic to paracetamol?
No.
No, okay. I'm also going to do a drug check. Says it's paracetamol, 500 milligrams. He can have up to a gram because he's an adult. Expires next year. Hasn't been opened. So that's all intact. Could you please do a drug check, please, Taha?
Yeah, paracetamol 500 milligrams and it's not expired.
Okay, cool. So I would administer this to the patient, and I'll probably give him one tablet, and we can give him another tablet when we are travelling to the hospital. So there you go, give him the paracetamol. Go back, getting the pain scale again. So Jairus, on a scale of 1 to 10, how bad is your pain now?
About a 3.
About a 3, okay, that's good. So we are now going to apply the splint since the pain has been reduced. So if you could support that, Taha, and on the count of 3, we're just going to lift. Take a few puffs of the methoxy, Jairus. Okay, 3, 2, 1. There you go. Just like that. Okay. And we're just going to secure it into place with the triangular bandages. Okay, Taha, if you could please get some more limb baselines while I check the laceration. I'm just going to check your laceration again, just to check it's not still bleeding. Okay, so that appears to still be bleeding. So I am going to apply a tourniquet. Indications for a tourniquet are if your other methods of stopping the bleeding have not worked, and they haven't. We've applied 2 bandages with direct pressure and that has not worked. So we're going to apply a tourniquet 10 centimeters or about 4 fingers above the wound, not on a joint and as proximal as possible, exposing the arm. And Taha, what were the limb baselines? They're okay?
Yep, pedal pulse is 60, cat refill is 2 seconds.
Okay, great. If I could just get you to do some vitals up here while I'm doing this, please. So I would twist about 2 to 3 times, just enough to stop arterial bleeding. And I would note the time, so it's about 4:30, write the time there. And I would remove the bandage to check that it's actually stopped bleeding. once I've removed the bandage, I'm going to take a radial pulse, and that is to make sure again that there is no more blood flow going to this area. I'm going to check that. Yep, and there appears to be no pulse. We would not remove this tourniquet until we get to hospital and there's someone capable of stopping the bleeding present. And we would probably give the patient another tablet of Panadol on the way to the hospital, which the nearest one would be Middlemore, and that's about 10 minutes away. And were the patient's vitals up here okay?
Yep.
Yep.
Blood pressure's the same, 120/80 and heart rate 60.
Okay.